السلام عليكم، صبحكم الله بالخير جميعاً. أولاً أحب أشكر جمعية دمي على الدعوة وهذا التنظيم الأكثر من رائع. أحب أشكر أيضاً Scientific Committee for inviting me to present in this conference. Today, my talk is about the strategy of MOH to reach 100% volunteer blood donation. So we'll talk about the objective and the current state in our MOH blood banks, and then we will go for global overview and WH framework. And next we will talk about KSA, why we have a low volunteer blood donation. And then we are going to give a brief about the roadmap for 100% volunteer blood donation. So the problem statement that we have a lower percent volunteer blood donation compared with different countries. So our percentage in Saudi Arabia is around 76%, and this all data from MOH blood bank only. So our goal to design and execute national initiatives to increase the blood volunteer donation to reach 100% and to reduce the replacement donation from 24% to 0%. So this is overview about the statistics in our MOH blood bank. The overall blood donor, as we said, the volunteer donation, 76% and 24% replacement. The female donation is around 4%, and also the male donation, it's a total of 96%. I think it's this is a benchmark for some global countries, for Canada and UK and Australia. So all of them, they reach 100% volunteer donation. So the statistics in Canada, the Canadian Blood Service, they collect around 756,000 blood units annually. And for UK, they have 1.5 million blood units annually. And the interesting things in UK, they have a high percentage of female donation, higher than male. So they reach around 55% female donation. And also they collect around 250,000 platelets units and 250,000 liters of plasma for plasma fractionation. In Australia also, they reach around 1.6 million blood units annually. So how we can learn from their experience and to achieve our goals? This is initiatives that proposed by WHO. It's around 20 initiatives. So I'm not gonna go through all of these initiatives now. We just have different goals. It's 4 goals, and each goals, they have certain initiatives. So the first one is they create an enabling environment for 100% volunteer blood donation. For example, they look for strengthening collaboration and partnership. For example, like Jum'iyat Damy, they have a lot of collaboration with some institutes, and this also to help increase and help the easy accessibility to the donation center. Goal B, foster a culture of volunteer blood donation to understand the blood donors by using, for example, patient experience platform. The goal C, build and maintain a safe, sustainable volunteer donor base. And the last one, to provide quality donor service and care. So we will go through some of them that we thought is important for us, and it will help and improve the volunteer blood donation. The third section that we are talking about why KSA has a low volunteer blood donation. So we did actually some research, and according to some published article in Saudi Arabia, and the second point, we did a procedural assessment, and we have thoroughly assessed the current procedure in Saudi Arabia, starting from the donor recruitment until they finish the donation. And then the facility-related concern, we know most of our blood banks, it's belong to a hospital or institute, and this is make the donation for most of the donors, they feel it's very difficult to go and donate due to, for example, difficulty of car parking and etc. This is some of the statistic we found it when we conducted the research. It's in Saudi Arabia. So there is one study, they talk about general awareness of blood donation among Saudi public. And this is the sample size for each study, and the percentage of people when they conduct the study that they have high understanding or awareness about donation, or moderate or low. So when we're looking at the low percentage that they don't have much awareness of about blood donation, we found that there is one study on the first one, 2021, they have 52% from those population, they don't have enough awareness or understanding about blood donation. And there is another study also conducted in 2018. They have 22% of, from the sample size, they don't understand much about blood donation. And the last one, they have 48% also. They don't have enough awareness about blood donation. The second one, what is the most reason that they have for less blood donation among the Saudi public by region? And when you see here the statistic, it shows that they don't have enough time, that 59%, and also the family, unable to access blood bank, as we said, because there is no assigned or specific car parking, and it's not easy access for everyone to donate. And those two areas, it seems that we have a higher percentage that caused less volunteer donation. The key takeaway, so surveys reveal a significant percentage of people who lack general awareness, as we said, and leading to widespread misconceptions and tears. Primary reason for not donating blood were inaccessibilities of blood bank, as we said, also not having enough time, and family discouragement, similar to result from other studies. This is the roadmap, as all you know, that starting from donor enters the blood bank and starting filling the questionnaire and etc. I'm not going through it because all of you, we know this process. So also when they ask donors what is the most area during donation that they have spent more time, so what the answer is, it's about the filling the questionnaire. So we need to think also about how we can make filling the questionnaire for donor to be easy access. For example, have them like automation, or they have to fill it before they came to the donor center, and something like digitalize the questionnaires. Presentation. So almost the average time to fill the form is taking 10 to 15 minutes. So as we said, we need to find a solution that we can digitalize the questionnaire, and if the donor can fill it before coming for donation. This is an example of different scenario in blood bank. It's the closing time is having different closing time, and also the open on weekend. They have some of them they open, some of them they don't, and also the female compared to male staff ratio. So most of the area that they have low female compared with male, and this also could affect the donor satisfaction. So this is a takeaway message. Blood banks closed during weekends will impact on facility-related concern. The closing hours of blood banks currently at 4 p.m. may pose challenges for working people. So we know now there is a discrepancy between most of the blood bank. Some of them, they work until 7 or 8, and some of them, they close 4 o'clock. Also, as we said here, during weekend. So if we think about how we can concise the time for all blood banks, they have same opening hours, they have the same working days also during weekends, it will improve for sure the volunteer blood donation. The last point, which is privacy for separate facilities between some of the female, they prefer to have a privacy. So the facility design is very important to maintain and return the volunteer blood donor. So the roadmap for to reach 100% volunteer blood donation, we have three, let's say, component or three section. The first one, marketing and awareness. The second one, digitalize the process. The third one is functional and infrastructure. So this is some of the initiatives that already we started in the blood center, and some of them in progress. Some of them it's still new. We're preparing to start. And again, this is not only for MOH, because this initiatives and project, it should be among all blood banks in Saudi Arabia. So we launched a national awareness campaign program to increase the volunteer blood donation. The first initiatives, we should work on motivational and educational videos, school education materials. So we should include all the educational materials, I think from elementary school until the student they graduate from the school, to prepare the new generation and to understand the donation process and why we donate and the importance of the donation from the elementary school. The second one, we coordinate in partnership with non-government organization and charitable trust. As we said before, جمعية دمي, mashallah, they are very active and they are willing to collaborate, and already they collaborated with many institutes to open a donation center. And then the last one, we established a college, university, and corporate organization campaign program to advocate for volunteer blood donation. The outcome, it's going to be greater public awareness and higher voluntary blood donation rates. And the second one, we strengthen partnership and border outreach for donation campaign. Number 5, we sign cooperation agreement with government bodies like Ministry of Education, most of the ministry in Saudi Arabia. The fifth one, we encourage companies to implement donor days, policies for their employee. For example, they give like incentives, 1 day off if they donate. And also this one we already started to work on to enhance corporate support for blood donation and employee engagement. The second one, patient blood management. So we know most of the women now, because we have a low percentage of female donation in Saudi Arabia, it's almost 4%, which is very, very low. And the most of the reason why women, they don't go for donation, the first reason is a medical condition, which is belong to anemia. So we already had a meeting with the public health, so to start a pathway, we'll say model of care pathway, when female came to donate and they have low hemoglobin, we will direct the system, automatically give her an appointment through model of care to treat the issue. So as we said, we launched a public program to encourage women to test and improve iron level in primary health care, and to partner to the lab to test CBC and automatically schedule appointment through a maw'id to treat anemia. And then we focus and improve the current incentives programs, which is the medal and rewards. Establish feedback mechanism of continuous improvement to be part of each initiative. As we said, we already have a contract with Bristol for patient experience, and we analyze all these data and feedback from patient for donor, and then during the analysis, when we finish the analysis, we start initiatives based on that outcome or result. Blood bank information solution, we establish a national donor database and information management system. We already have a contract with Hematos, and we start implementing the PBIS in 133 blood bank and MOH institute. And the second phase, we're going to implement also the PBIS in 109 blood bank, the remaining blood bank in MOH Institute. So not only this, we have a plan also to connect all these PBIS information system with Abshir. So all the travel for the donor and everything, it will catch up by the system, and it will give you if this donor went to the country that prohibited from donation. Blood donation portal, also accessible online portal with easy access to location and scheduling an appointment. As we said, it's going to be automated questionnaire. They can fill it before they came, and they can take an appointment to make it easier for to have a donor experience. Resolve the accessibility issue by introducing donor-friendly mobile campus and unit. And this is most of the blood bank, I think they have these initiatives. Plan to increase the number of female phlebotomists and nurses in blood donation campaign to make it easier for and comfortable for female donation. Create dedicated, well-equipped and private space for female donor. Also, as we said, we have to make a privacy for female to make them comfortable when they come and donate. The takeaway message, as we said at the beginning, this initiative is not belong to MOH Blood Bank only. I think we should have a collaboration. We should work together to reach 100% volunteer donation and increase it in Saudi Arabia and reduce the replacement donation. It's not reduced, actually. We have to stop the replacement donation. And this is my presentation. Thank you so much for your listening. I hope you enjoyed it. Thank you.